tubing biopsy of the biopsy demo. I'm assisted by the lovely clinical application scientist Stacey, who's going to demonstrate the technique. Please give her space in which to do that. You can come and get personal later on and have a go yourself. So with tubing, it's probably the step at which you're most likely to get contamination of the biopsy samples. So it's critical that you carry this out using full personal protective equipment. Now, Stacey obviously isn't wearing a mask or a hat or long sleeves, so you need to cover as much of your body as possible to avoid unwitting contamination of the biopsy sample, because if it's contaminated, then we simply won't be able to get a clean result and give you a diagnosis of that biopsy. So we tend to work at, it's very important to work at room temperature when you're doing this. You don't want to cause any evaporation of the small volume of buffer in the PCR tube. So what we tend to do is we tend to put the rack on a cooled block, so it reduces any risk of evaporation of that medium. And we only would put out 3 tubes at a time for a similar reason. We don't want to try and pre-fill too many tubes with buffer. So we would preload the tubes with buffer and immediately cap those tubes, again, to reduce the risk of contamination. And also, if you're working in a laminar flow hood, which you should be, it's very important you do not have the laminar flow running, because you don't want to have a draft of possible DNA coming over your samples. And of course, prior to starting the procedure, you would have decontaminated the whole working area using DNase free, not alcohol, because that would just fix the DNA in place. So you place your PCR tubes on your rack and you place a barcode around each tube. So the barcode will be specific to that patient, but you still need to write the number of that particular biopsy that you're going to tube on the label and on the top of the tube. Then you would set up your washing dish. So you would not do this in advance because, again, you don't want evaporation of media from your washing dish. So you'd set up your washing dish with 4 20 microliter drops of the buffer, as shown in those big circles there. And you'd have your biopsy in that center drop of the biopsy dish, from which you've, of course, taken the embryo out, put it back into culture. So when you transfer the biopsy from the oil overlaid drops of biopsy medium to the first drop of your washing medium, you may at that stage wish to change your your handling pipette because it's covered with oil. But then you can wash the biopsy in that first drop and then expel any leftover media in your biopsy, in your washing pipette, and then go to the second drop, aspirate some fresh media, go and pick up the biopsy from the first drop, transfer it to the second drop, wash it again, expel any excess medium, and again do the same thing all the way through to drop number 4. Okay? And then after that, once you've got the biopsy into drop number 4, you can then set up your PCR tube, and we typically put the cap lid over a dish for then transferring the biopsy to the PCR tube. So you can see here, you can see the PCR tube with the cap of the tube over the edge of a Petri dish, so you don't have to hold it in place. You can then focus exactly on your media inside the tube, and we tend to put the buffer slightly up one side of the tube so it's easier to see the washed biopsy drop into the tube. And here it's really critical that you're using PCR tubes that you can actually see through. So unless you have translucent PCR tubes, it's going to be very difficult to confirm that your biopsy has entered the buffer. And you'll see that the tubes that we use are beautifully clear, easy to see that biopsy dropping in. So you'd focus on where the buffer is at the bottom of the tube, and then you'd pick up your washed biopsy and you'd see it drop into that tube, and at that stage you would then check that there's nothing left in your handling pipette, so any sort of negative pressure that might have occurred, and taken the biopsy back up. So you always expel the medium remaining in your washing pipette, and then you can close the tube and then fill in all the details on the worksheet. And we also recommend that you use a microfuge to spin down that biopsy in the tube to make sure it's at the bottom of the tube before you then package it carefully in the rack box and store it in a minus 20 degrees stable freezer. You don't want the freezer going through cycles of warming and cooling. And then you can ship the sample according to your genomics provider's instructions. So I'm going to hand over now to Stacey, and what she's going to do is she's actually going to handle a complete blastocyst, so you've got a better possibility of seeing what she's handling. But of course, normally it would be 5 to 10 cells of a biopsy. So of course, when you're handling the rack, you'll be wearing gloves, and everything inside the box is sterile. So you treat it in an aseptic method once you've opened the box. Today, of course, Stacey isn't wearing gloves, but she would normally be doing so. So she's capping all the tubes straight away, and to minimize the risk of contamination from extraneous DNA. Most contamination actually comes from ourselves, which is why that PPE is so important. Now she's taking the buffer with a calibrated and certified micropipetta, so she knows she's only putting 2 microliters into each of those PCR tubes, and then immediately capping them, again, to minimize the risk of contamination. Now she's using the barcode labels to label each tube. Now she's setting up her 20 microliter drops of buffer for the washing. So again, doing it immediately before she begins. Okay, so she's now transferring that sample, you can see it quite clearly there, to that first washing drop. And then giving it a wash in the second drop, again expelling any maybe not so clean media from the previous drop. So that by the time she comes to the final drop, any loose cells, any other material would have been washed away. So she's got the cleanest possible biopsy that she can have to then transfer into that PCR tube. And as with the biopsy, do not coat your handling pipettes with PVP. So again, we don't want to expose these cells to PVP. So she's now going to transfer that biopsy to the PCR tube. Oh, you've done that, sorry. I missed that bit. Okay, so she's so efficient, so quick, she's already transferred it to the PCR tube. Okay, so do we have any questions about the tubing process that you'd like to ask? Yeah, one here. Sorry, I'll come.
I see the image of the after tubing putting into the PCR tube.
Yes.
After that, I can see that image.
You couldn't see it?
Yes.
No, I think part of the problem is that unless the camera is parfocal with the lens, it's sometimes difficult for her to see what she's doing and for you to see what she's doing. But you should be able to see the biopsy drop in to the buffer at the bottom of the tube. That's really important, because unless you see that, let's say you get a no result back, you can't be confident that it wasn't because you didn't manage to get the biopsy in the PCR tube. So it's really important to have a nice PCR tube. You can see right through it.